test is a screening test for cervical cancer. This is used to identify the abnormal cells on the cervix that could lead to cancer so that we can do diagnosis and treatment early, so for cancer prevention. It's usually done at the time of your annual exam. The physician uses a brush or brushes to scrape off cells on the outside of your cervix. They then put this in a liquid medium and send it to the pathologist. The pathologist then looks at these cells and they're going to identify, are these cells normal or abnormal? The abnormal cells have a lot of different names. They can be called dysplasias, they can be called precancerous, or squamous intraepithelial neoplasias. There are different grades of these types of cells. If it's a low-grade abnormality, this means that a small amount of those cells have a minimal amount of change. If it's a high-grade lesion, then more cells, or majority of those cells, have a marked abnormality. And then finally, cancers mean that all the cells show cancerous changes and can show some invasion. HPV is the human papillomavirus. It's the most common STD in the U.S. 80% of women will have HPV at some point in their life. It causes about 90% of cervical cancers, about 69 to 75% of vaginal and vulvar cancers. It's also associated with oral pharyngeal cancers and anal and penile cancers. There are over 100 types of HPV identified. There are low-risk types of HPV that can cause genital warts and high-risk types that can cause female and male genital cancers. Most of these do go away on their own without treatment. However, the higher grade lesions at some point may require further diagnosis and treatment. The longer a woman has HPV and the older she is, she's at more increased risk of those abnormal cells progressing to a higher grade lesion and cancer. Also, if that woman is immunocompromised, has HIV, or is a smoker, she's also at risk. The two types of tests we use for cervical cancer screening are the Pap test and HPV test. Depending on your age and your health history, depends on what your physician is going to choose for you. Studies have shown over the last decades that routine annual exams with Pap testing has no advantage over papping less often. And also, if you check a HPV co-testing with your Pap, the likelihood, if your Pap is negative and your HPV is negative, that you will develop a progressive or cancer within the next 4 to 6 years is an extremely low risk. The guidelines have changed over the last several decades. The newest guidelines recommend that women start screening for PAPs at age 21. So the women aged 21 to 29 should minimally have a PAP every 3 years. If you're aged 30 to 65, you're recommended to have a PAP with HPV co-testing every 3 to 5 years, or PAP alone every 3 years. If after age 65, if you've never had an abnormal PAP or treatment for an abnormal PAP or cervical cancer, and your PAPs over the last 10 years, whether it's been PAP alone or PAP with HPV co-testing, if all of those are normal, you can actually stop your PAP smears. Now, women that have a hysterectomy or the history of the abnormal PAPs that are immunocompromised or have HIV do not usually recommend, we don't recommend that they follow these guidelines. So if you have any questions, please speak with your physician when you go in at your next appointment to find out what PAP schedule is right for you.